signed into law a tax bill that cuts over $1 trillion from Medicaid and the Affordable Care Act marketplaces, the largest in our nation's history. 15 million people are at risk of losing their health insurance because of the Republican tax law. And now, because of other actions and inactions by congressional Republicans, over 20 million Amerians are at risk of seeing their premiums double next year. This includes, as Audrey was just talking about, over 300,000 people across Massachusetts and 18,000 people in this district who enroll in healthcare coverage through the Massachusetts Health Connector. Marketplace premiums will skyrocket by hundreds to thousands of dollars, which is also the single largest price hike in U.S. history. People could see the sticker shock as starting November 1st when they sign up for coverage for next year. For example, a typical family of four, premium hikes will be 26 times larger than expected rent increases for next year. What does this mean for Massachusetts and the 5th District? For hundreds of thousands of people enrolled in the marketplace in the state, premiums could increase by thousands of dollars. A 60-year-old couple in Massachusetts 5th District making around $83,000 a year could see their annual premiums increase by over $14,000. A family of four earning $64,000 a year would see their annual premiums increase by almost $2,600. I want to put these into further context. 2 out of 3 American workers are unable to cover a $500 emergency expense, like a flat tire or a leak in their roof. For someone making $35,000 a year, which is around $17 per hour, they will see their premiums rise by nearly $1,600 this fall. That's the equivalent of needing to work almost 12 hours a day for 18 days straight if your boss and your workplace will give you the hours. This doesn't account for their childcare, gas, and other expenses that they would incur to increase their working hours. Let us not also forget the nearly 50% of adults in the marketplace who are employed by a small business, self-employed, or small business owners. Small businesses have been growing across your state, covering over 1.5 million employees. These nearly 600,000 small businesses serve as backbones to Massachusetts communities, and we should be celebrating these small businesses rather than placing excessive strain on them to afford health insurance. And this is just talking about marketplace coverage. The massive cuts that congressional Republicans are making to Medicaid will have ripple effects that could push Medicaid enrollees, like children with disabilities, adults juggling low-wage jobs, and older Americans who rely on home and community-based services, as well as our healthcare system and state budgets to their breaking points. This will harm all of us, regardless of whether or not we are covered under the Medicaid program or receive coverage through the marketplace. People across the U.S. are already seeing the warning signs for the Republican tax law. Over 300 rural hospitals are at risk of closing because of the Medicaid cuts. Many hospitals in urban centers are also considering closing down centers like their labor delivery units, foregoing hospital expansions for new services, or closing down altogether. No one in Massachusetts or anywhere in this country should have to forego health insurance because it is too costly. No one should face financial strains on their small business due to skyrocketing premiums. And no one should have to drive for hours more because their rural hospital has shut down. People across this country deserve a healthcare system that is both affordable and accessible, rather than a healthcare system that forces them to choose between coverage or affording their groceries. But this is not inevitable. This tax law and the decision not to renew the critical healthcare subsidies have sent us down a trajectory that will force millions of Americans to face this reality unless changes are made. We hope that Congress will hear this and vote differently. Thank you, and now I'll turn it back over.
Thank you. And just another reminder, if you do have a question, please press 0 on your keypad and a member of our team will put you into the queue.
Thank you, Chiquita. We really appreciate the national perspective on this. And next, for a more local perspective, we are joined by a longtime advocate for health equity, the president and CEO of the Massachusetts League of Community Health Centers, my friend, Michael Curry. Thanks so much, Michael.
Thank you, Congresswoman. It is an honor and a privilege to be on tonight with the phenomenal experts locally and nationally to speak to these issues. I have to say, Congresswoman, that we appreciate you as a champion for all things health equity and for access to the health safety net for primary care. I want to start with the fact that this year is the 60th anniversary of health centers in this country. 60 years ago, in 1965, was that first health center in Dorchester and Columbia Point. We now have across the country over 32.5, I think we're even close to 34 million patients being seen at community health centers. Over 1,400 health centers in the country, 50 of them here in Massachusetts, and over 1 million patients being seen by community health centers. So think about what a difference 60 years makes in terms of people having access to care, a primary care provider, from treating disease and doing it in an equitable way where people, no matter who they love, what their race, what their religion, or their nationality, they have access to care at a community health center. When we think about these federal threats, I want you to think about that in that context, how far we've come and how far some of these policies will set us back. So when we think about the Massachusetts 5th, I want to speak specifically in Waltham with Charles River, Edward M. Kennedy, Community Health Center in Framingham, South Cove, Community Health Center in Malden, and Neighbor Health in Winthrop. Close to 30,000 patients, many of you probably on this call tonight, that rely on community health centers. We are deeply concerned about the shifting federal policies that the Congresswoman and my colleagues have talked about tonight. The one big bill, changes in Medicaid and what it will do in terms of access to Medicaid services. And my colleagues have talked about the other aspects of the bill. I just want to maybe hone in on what those impacts could be. One is what we call our Section 330 grant funding, which is the funding that comes into Massachusetts and supports federally qualified health centers. Congress takes up and deliberates on that funding and increases to that funding. And we are deeply concerned, $4.8 million in Section 330 funding to sites in the district coming in annually, that we need to make sure that that funding is addressed and is increased so that the necessary resources are there for health centers, particularly in the Massachusetts 5th, are available to do what we do best, which is to provide primary care to address disease and keep people healthy. When we think about work requirements, the whole notion, as we know, that 92% of those who have Medicaid have a job, or they have a circumstance that warrants them not working. And now we're looking at a policy that requires this annual, semi-annual redetermination and recognition that they have work. That is going to be disruptive. We've seen across the country that policy kicks people off of Medicaid and results in many of our patients not being able to maintain their access to Medicaid. And I just want to connect the dot for you when I say this. When you don't have coverage, you most likely don't get care. And here's why. We know, Congresswoman, before the Affordable Care Act, almost 49 million people didn't have access to coverage. They didn't have insurance. The privilege that many of us take for granted, that card we have in our pocket. When you don't have coverage and you have to, out of pocket, in many cases across this country, walk in and say, my teeth, my eyes, my mental health, my substance use disorder, Maybe that pain in your side is a stage 1 cancer. If it gets diagnosed, by the time you come into emergency room, could be stage 4. That is not access to health care. That is actually not making America healthy. And in fact, it leads to people avoiding care. We know that they show up in health centers with higher acuity. They show up sicker when they don't have insurance, and they avoid care until the very last minute when they have no other option. They show up in our emergency rooms and they show up in community health centers. And when you kick people off of coverage, as was said earlier by Audrey, we will see large numbers of people flooding into health centers to get care, the capacity for which we actually don't have, and they'll be forced to come to community health centers on top of the patients we already care for, without coverage and without access and the timely support that they need. The only other thing I would say is, what we're facing in this country is a disruption to all the progress in the 60 years we've made. We increased access. We've embraced health equity, the fact that you can deal with disease by going after where it is most, by zip code, by neighborhood, by race, by gender. And all that is coming out of this policy is disrupting that and causing us to hide words, avoid certain programs and services. Some disruption around gender-affirming care would be an example of that. And then to have to make some tough decisions about who we can see and who we can't see. If there was ever a thing in 60 years that disrupted our mood in this movement, because we are usually excited and energized about serving the populations that we serve, there's a heaviness in the movement right now as we're being told that we can't see some patients and that we have to abandon what we know worked over the past 60 years. So, Congresswoman, again, I am deeply grateful on behalf of members not only here in Massachusetts and in the Massachusetts 5th, but on behalf of health centers across the country. I've been asked to deliver this message to you. Thank you for your leadership, your steadfast leadership, your advocacy, and we are hopeful with you and your colleagues that we can renew a commitment to healthcare access, affordability, and quality throughout this country.
Thank you, Michael, and that is our goal, and we so appreciate your work and you being here tonight, and I thank all of you for your insights. As we continue to collect questions from our audience, I'm going to start by asking our panelists some of the most common questions that I've been hearing lately. I'm going to start with Audrey. One of the questions that we get is, how will people in Massachusetts know whether they have lost their ACA tax credits?
Yes, it's a great question, and the answer is we are in communication with our hundreds of thousands of members right now. There's actually notices that have been going out over the last week or so and will continue for the next week, letting people know about changes that are happening for their 2026 coverage. So that those notices will include that information as well as emails, et cetera. We've also set up a special web page on our website with ongoing updates and information about federal changes that will be affecting people's coverage and providing tools and support and more detailed information around all of those changes. I would also note that in addition to that proactive, letting people know about these changes, and in many cases, the fact that people will be either losing enhanced premium tax credits altogether or the amount of subsidy they receive will be reduced. We have taken pains over the last several months to get our call center and our customer service support system as ready as possible. We know people will be experiencing a lot of questions, a lot of stress and worry about these changes. So we're doing everything we can to make sure that the folks that people will turn to when they get these notices and get this news have the information they need to guide people through the tough decisions that may be ahead.
Thank you so much, Audrey, and we know that people appreciate that as these notices start to hit, to be able to call on your office and get the answers and guidance they need. My next question is for Chiquita. You touched on this in your comments, how these impacts will harm all of us, but it is a question that I get. People ask, well, I'm not on Medicare or Medicaid, and I don't get my insurance through the ACA. So how is this going to impact me? Maybe if you could go into a little more detail about how this will be a cost driver for everybody.
Absolutely. I mean, if you look back and think about what we've experienced over the last decade, really, there have been times when other people's health has affected us all. And COVID-19 was a perfect example of what happened to care when our country experienced a health issue. Even if you didn't have COVID, you had difficulty getting in the hospital for important surgeries for a period of time when the hospitals were overwhelmed. And that's one example of what happens when people, how even if something's not happening to you specifically, we are all linked in some ways in the healthcare system. And what is happening in so many rural areas of our country is that a lot of rural hospitals in this country, as well as other providers, are very dependent on Medicare and Medicaid for revenue. So these changes where we have uncompensated care mean that either hospitals have to take you if you're sick. So if you show up at the door, they are taking you and you're less likely to come for routine care. So you come in an emergency. That cost ends up being spread across all of us who have insurance. So that's one example. The other really important piece is that if hospital areas shut down, that affects all of us. And we have already started to see across the country that hospitals have said they are closing. And one question people say is, well, why? The Medicaid cuts haven't come yet. But if you're a hospital exec and you're looking and knowing that your revenue is going to drop, you start making decisions about whether you could keep your either your hospital open or places like labor and delivery, which often are not revenue generating parts of the hospital open. And these are things we are already seeing across this country. So I really worry about just the fragility of our healthcare system in certain key areas. And it's true in urban areas too, that even though there may be you may be close enough to the hospital, the hospitals that serve a lot of the underserved are incredibly dependent on Medicaid and ACA coverage.
Yeah, that is such an important point. And I think in Massachusetts, we have been benefiting from really good healthcare coverage. And it is hard to think about the changes that could be impacted even in our home state. Michael, sort of to keep going on that question, you talked about the disruption to access and what these potential new requirements could mean in real time. Maybe you can walk us through what has this year been like for Massachusetts community health centers? Because as Chiquita just pointed out, even though the Republicans tried to put some of these Medicaid cuts off until after the midterm elections, we are feeling impacts. And I wonder if you can bring that through a local lens for us.
Absolutely, Congresswoman. I think first and foremost is to think even prior to the change in administrations, health centers across the country were already struggling in large part for a myriad of reasons. One being that the higher acuity of patients coming back post-COVID, higher costs in goods and services, higher costs for workforce, a mix of issues. So there was an estimate that we were already looking to lose 25% of the health center sites in the country due to the financial conditions even before the change in administrations. That's devastating when you think that there are, I think now 1,600 practice sites, or 16,000 practice sites, 25% of those being lost. Take that in for a moment, right? We're in every corner of the country, right? We cover in Massachusetts 97, almost 98% of the zip codes in the Commonwealth People are driving, sometimes long distance to get to a community health center, but that's across the country. And now you're threatened to lose them because of financial conditions. So now to these policy shifts, what that means is that we're now looking at potential major losses, even here in Massachusetts and in the Massachusetts 5th, an estimated 92,485,000 health center patients in Massachusetts could lose Medicaid coverage due to work requirements. Just take that number in for a minute, almost 100,000. We are 98% insured in the Commonwealth. We're looking at maybe 300,000 people losing insurance. And I take you back to the number I said earlier. When you don't have insurance, your choices are really difficult. Eyes, teeth, mental health, disease. You are now more challenged to get care because that cost of that visit you can no longer afford. I want to lift up what Chiquita said about hospitals. It's true for health centers as well. We see you regardless of ability to pay. You walk in, we don't care if you have Medicaid. Well, we actually do care. If you have Medicaid or you're commercial, we want you to have the best, fullest insurance you have access to. And we want that insurance to reimburse health centers at the full cost of the care that we're providing you. If that's not the case, we lose money on every patient that walks in the door. And even though we see everyone who walks in, it strains the finances of the organization. So just let's connect the dots here for a minute. More and more people will not have Medicaid, which in Massachusetts reimburses health centers well, based on negotiations years ago. Health centers are getting fair reimbursement for Medicaid. Now there'll be uncompensated care. So that means people will be walking in without insurance, and the care that they get will not be fully reimbursed. Will be, to your question to Chiquita, they'll walk in, and now a wait time for a new patient today could be several weeks, if not months, could be extended several more months, because now many more patients are coming to health center because they have no other access point for care other than community health centers in an emergency room in a hospital. That has severe implications on us. I want to connect the finances. The state reported that these challenges will reduce federal funding to Massachusetts by some $3.5 billion a year once the bill is fully implemented. To your question to Chiquita, which I think is implicated your question to me, $3.5 billion lost to the state budget is significant. So no matter where you are in Commonwealth and you're benefiting from the state being able to balance its budget, invest in the critical resources and services of the state, that is a major loss in revenue to the Commonwealth, which will hurt you no matter where you are, no matter what your political affiliation is. You're going to be hurt by this bill in the Commonwealth. In addition, the legislation jeopardizes health coverage for an estimated 4 million community health center patients nationally, and is projected to cost community health centers $7 billion annually, increase uncompensated care costs, which I just talked about, with an estimated $13 billion in total economic impact, and in jobs. The changes could lead to at least 34,000 community health center job losses and 1,800 community health center site closures across the country. I know this sounds doom and gloom, dire. It is. That this was not the best decision. This was not wise policy, and it does set us back. So we have to now, Congresswoman, with your leadership, make sure that the constituents, your Massachusetts 5th constituents, and those across the Commonwealth, understand that these have severe consequences for all of us, not just those on Medicaid, not just those that are uncompensated, not just people who are poor and marginalized, not just Black and brown folks. Everyone is impacted by these policy changes. And I so appreciate you hosting this forum tonight to make sure that people get the critical information they need.
Thank you so much, Michael, and for emphasizing this is something we're all going to be impacted by, and of course for the work you do. So we are now going to turn to questions from our audience. And Kelsey, what do we have up next?
All right. First, we have Audrey from Framingham. Audrey, you should be unmuted.
Okay, thank you so much. I am Audrey Hall. I am the chair of the Council on Aging in Framingham, Massachusetts. Our Council on Aging took a vote yesterday to reach out to you and others in Washington to please ask you to do whatever possible to extend the open enrollment period because thousands of Massachusetts seniors are now losing their Advantage plans and are only being given a very short window to find a new plan, which may also involve finding a new primary care physician. And in doing so, they often seek out assistance from volunteer Shine counselors, and their time is also limited because they are not only helping seniors experiencing this loss of coverage, but also people who are enrolling for the first time. And the demand is so high and the window is very narrow. So the request was to see if possibly that open enrollment period for this special circumstance could be extended for 60 days beyond the normal deadline. And if you and others like Senator Warren and Markey might be able to help make that happen.
Audrey, thank you, and thank you for the work you do at the Council on Aging. They're just key lifelines for our communities and certainly for Framingham. So this is an idea that we should be considering, extending the Medicare Advantage enrollment period, certainly extending the ACA open enrollment period. The problem we are facing right now in Congress is that the Republicans in the House have decided they're not coming in to do their jobs. So we are at this total stalemate about how we can be helpful because they will not call us back into session. And so we have been out of session for, the shutdown's been 22 days, but we have been out of session for 10 days added to that, so over a month. And so these ideas that we should be working together to find solutions for are just being completely stalled by a Republican leadership and House members who are refusing to convene us and do the work of the people. So these are ideas that we should be talking about as people at home are facing really tough decisions, whether they're seeing premiums go up or the situation that you've described with Medicare Advantage. I don't know if Chiquita or Audrey have anything else you'd like to share, but it is a deeply frustrating situation, and the urgency of it is so immediate because these decisions have to be made by people. They can't give themselves an extension. It has to come from Congress and this administration.
And this is Audrey Gassire from the Health Connector, and I would, echo all of that. And obviously on the Medicare side, defer very much to the whip there. And just wanted to briefly say on the Affordable Care Act open enrollment period, we're also thinking about that and tools we may have to be able to just ensure that people are able to avail themselves of enrollment opportunities and information, particularly if something does happen with enhanced premium tax credits coming through and people are making new decisions with new information and the like. I would just note that there was a regulation finalized by the federal CMS agency this year that actually takes away states' abilities to set their own dates for open enrollment periods for the Affordable Care Act. Fortunately, it doesn't go into effect until next year. So this year, Massachusetts is able to keep its ACA open enrollment period open through January 23rd, which is longer than the federal marketplace has done historically. So we're glad for that flexibility and frustrated that in future years, it seems like the federal regulations will be sort of rescinding that state flexibility. So something we're going to continue to press on and do everything we can to make sure people have appropriate windows to make decisions about critical topics like their health coverage.
Thank you so much, Audrey, again. And Kelsey will take the next question.
Great. We've got Chester from Wayland. Chester, you are on the line.
Thank you, Congresswoman, for setting this up. It's very helpful. So my question is, many of the rural hospitals and clinics in this country are in red states. Do people in those states that are receiving those services, are they being informed about the severity and what this will do to their health care? And if so, Are you hearing that at all from any of your people in Congress?
Yeah, thank you, Chester, for this question. And it's one of the, it's just another one of the dreadful, horrible impacts of these cuts. And the irony that some of these cuts are going to hit first and hardest to areas of the country that are typically have elected Republicans. We are going to see the ACA premium hikes really impact states that have not taken the expanded Medicaid. So those are states like Texas and Louisiana, and a state that I visited, Mississippi. And part of the reason for my visit there was to see for myself, to be able to talk to the people there with our only Democratic congressman from Mississippi, Benny Thompson, exactly what these impacts would be, and helping people connect the dots when they hear about things in Washington. One big beautiful bill, as the Republicans call it. It's kind of hard sometimes, I think, when people are busy with their families and their jobs and making a living and getting by to focus on all the process and ins and outs here. So we have been going to places like Mississippi, showing up outside of electoral politics and saying, tell us what your experience is and how are you going to handle these cuts coming up. And we have to continue to do that, talking to people who are impacted. This is not a political issue. This is really going to hurt people who voted for Donald Trump, who voted for Republican representatives who have betrayed them. They told them that, Donald Trump said, I will love and cherish Medicaid, and turned right around and enacted these historic levels of cuts, $1 trillion out of Medicaid. And so it is part of our job to do town halls, to show up in places where, it may not benefit us as far as elections concerned, but helping draw in Americans who are working hard, want to be able to provide by their families, and explain what is happening in Washington in real terms for their communities. And I can tell you that when I was in Mississippi, these cuts were pending. And the fear and anxiety that I got from patients, from administrators who were already having such a hard time making these programs work. And even in areas that aren't necessarily rural or something short of closure, we're seeing a lot of lines of services be closed down. And one of those that has really impacted families across the country is that I know on my tour, and we're seeing data across the country, I didn't see a single maternity ward in any of the hospitals that we were able to go to. And in fact, in 1/3 of all the counties in this country, there is no obstetric care available. And what does that mean to someone who's trying to receive prenatal care, to find a safe place to give birth, to be able to receive the medical treatment that they need, where not only that they can afford, but where they can live? So this is a continuing issue, but you're absolutely right. If the Republicans are not going to level with their own constituents, we are there filling that gap and trying to really reach out to patients around the country and explain exactly what is happening with their health care and what they have to prepare themselves for.
Next up, we have John from Medford. John, You are on the line.
Hi, Congresswoman. Thank you for doing this. I just had a quick question about healthcare providers like Planned Parenthood. Are they going to have to shut down?
Oh, thank you, John. You know, despite that President Trump signed into law defunding Planned Parenthood for a year, there is ongoing litigation. On September 11th, a federal court did allow that law to go into effect. This means that patients with Medicaid, we call Mass Health, cannot use Medicaid coverage at any Planned Parenthood clinic for anything but abortion care, which is covered by the state and not the federal government. But this doesn't mean that Planned Parenthood is shut down. It is still seeing patients at their 4 centers, and they urge patients to keep appointments and give them a call to get more information on where and how they can access the health care that they need. So my question, Michael Curry, are you and community health centers seeing more patients calling in as a result of these cuts to Planned Parenthood? Is that something you've noticed?
Yeah, well, we have a great relationship with Planned Parenthood, so we try to make sure that we're aware of the services they provide and any disruptions to the care they provide. We're not seeing any noticeable change from the disruptions to Planned Parenthood, but we're both tracking that so that we're communicating and we're aware of where people are having challenges to get access to those services. I am concerned, again, this is an ecosystem of healthcare. So whether it's hospitals, Planned Parenthood, community health centers, mental health providers, anytime folks and community-based organizations, anytime the good work that people do to keep people healthy, to deal with primary care, to get them the services they need, to deal with the conditions that make them sick, community-based organizations do that. Anytime they're cut, it hurts all of us, including community health center organizations and their patients as well. So we stay as connected as we can to Planned Parenthood, and we celebrate and appreciate what they do.
Thanks to both the Michaels for the question and the answer, and Kelsey will take the next question.
All right, next we have Reagan from Natick. Reagan, you should be on the line.
Hi, thank you so much, Congresswoman, for holding this. So I'm curious about, I know this isn't directly but tangentially related to healthcare coverage. So I have recently been through a divorce and am on, or was on, LIHEAP and SNAP. I've lost those benefits. I still am on Mass Health, but in my town, the town benefits require certification through the former 2 benefits to receive it. My children do have medical coverage through my ex-husband, and so while I rely on Mass Health, I'm less concerned in a sense about that, although it is a concern, but I am very concerned about how to receive the town benefits, and also knowing that not having those benefits, children who are cold and hungry are more likely to be sick.
Yeah, Reagan, I am so sorry to hear about this. And, you know, this is exactly the type of story that we have been hearing from way too many constituents. And they shouldn't, you know, the ability to feed your children, to make sure you all have access to health care should be something that you can assume here in the richest nation on earth. Unfortunately, what we have seen, and I'm going to ask Audrey if she can give you some more detail on thoughts around how to work with Natick. But I just wanted to say that over the summer, Republicans made the largest cut in the history to the SNAP program, the food stamp program. And they are now once again threatening the food security of millions of American families with their shutdown. Those benefits will run from the federal government until November. But then they have made a choice in the Trump administration to end those benefits and treat it as some sort of discretionary spending, which is an extremely cruel choice and unfortunately goes along with what we have seen from the Republican Party and the president on choosing tax cuts for the very wealthy at the expense of programs like food programs, SNAP, school lunches, Meals on Wheels. And so we are so sorry, and it is part of this fight to make sure that everybody has those basics that they need. So I'm going to ask Audrey to respond, but please contact our office so we can help you with your case in a more detailed way. Our district office number is 617-354-0292. And please don't hesitate to reach out. And Audrey, I don't know if you have anything else to add about the SNAP program.
Sure. No, I would just say I would be happy to connect you with folks at the Department of Transition Assistance who manage the SNAP space. So if maybe through Kelsey or some other way after this call, I could just make sure I get your contact information so I can connect you with the right folks over there.
Thank you, Reagan. We both look forward to hearing from you. Okay, Kelsey, next question.
Yeah, next we have Rebecca from Medford. Rebecca, you should be on the line.
Hi, this is Rebecca in Medford. I'm disabled and have Medicare, and I know that telehealth for Medicare expired on October 1st, and I've been trying to get answers about what's happening with that, if that's going to get extended, and even the hospitals don't really know how to answer the question of whether telehealth is going to be covered, even if appointments are scheduled. They're not necessarily canceling them, but then are we going to be sent the bill for them? So just looking for information.
Yeah, thank you so much, Rebecca, for this question. And I cannot tell you how frustrating it is not to be able to give you a great answer. On October 1st, the pandemic-era telehealth waivers for Medicare that allowed these services to continue and be covered expired. And these services, it sounds like, are critically important to you, and they have been so important to so many people that we serve and hear from in our district, whether it's people with disabilities living in nursing homes, caregivers, for many seniors, people who just for a host of reasons, it is hard to get into an appointment. And it is so deeply frustrating that this administration has chosen to create even more chaos in healthcare and cause such confusion among our providers, our clinics, our hospitals. So it sounds like you are already in touch with your doctor or the clinic where you receive your telehealth, but we would urge you and certainly anyone else on the call who is in this situation to please call your doctor or clinic before you cancel any appointments. We really want to make sure that for providers that are still having some limited telehealth, that you might be able to take advantage of that. But it is a key part of what we are fighting for and what we are asking the Republicans to come to the table and help solve for people who are so reliant on these services, and they're a great not only lifeline, but a great cost-saving way to deliver services. So it is beyond frustrating, the situation that you find yourself in, and so many people are finding themselves in once they allowed the telehealth waiver to expire. I don't know if any of our other guests want to add to that.
I think that you answered so well, Rep. Clark, that CMS has given out some guidance, but I know many people have been confused by the guidance, and just encourage, just as Clark said, to reach out to your providers. And also, back to the question before about Medicare open enrollment and this one too, make sure you're also reaching out to CMS to know of these concerns so that the administration is hearing it as well as Congress. Those letters and informing them absolutely matter.
Thank you so much, and please don't hesitate to also reach out to our office. Again, the number is 617-354-0292 if we can help connect you with those services. Thank you so much. And Kelsey, we're going to take one last question.
Yes, that's right. We're coming up on the hour, so we have John from Maynard on the line with the last question.
Hi, Congresswoman. I just first of all wanted to say thank you so much for holding this TeleTown hall meeting and being in touch with the folks in your district. It's really important, especially in these really weird times with the shutdown and so on. My question is about vaccines. I'm really scared about the possibility of me and my family being able to get vaccines going forward, in particular my two elderly parents. And I just wanted to kind of get your perspective and point of view on where that might be and where the future might be with vaccines. Thank you very much.
Thank you so much, John, for calling and asking this question. We too are hearing from a lot of other people who are really worried about what Secretary Kennedy is doing to vaccines, to science, to medical research in this country, and the ability to be able to access vaccines that have been such a critical part of delivering public health and great outcomes for people. So in particular with the COVID-19 vaccine, the good news is in Massachusetts that anyone over the age of 6 months is eligible for the updated vaccine and can still receive it as a Massachusetts resident for no or little cost. And we recommend that you go to Vaccine Finder, one word, vaccinefinder.org, and contact your local health department or community health center so that you can see where you might be able to receive all the vaccines. But we are incredibly worried about, as we are looking at flu season, increase in RSV, COVID spikes, that what the pulling back of the federal government from not only active vaccine programs, but how we are evaluating and bringing new vaccines to the public for their protection and security is just being completely disrupted. And that, in fact, CDC workers who work on these issues and are so critical to our public health infrastructure are being targeted specifically for firings and furloughs during this shutdown. It is really an attack on the public health systems that have kept the American people safe. So we are going to keep up the fight on our end. I don't know if, Michael, if you wanted to share any more details on where people can find vaccines.
I wonder, what the,
I think somebody's not on mute.
For them? like state resources, like?
Just very quickly, I would say this. So you said it all, Congresswoman. I came back, Congresswoman.
No, I haven't.
Benny Thompson invited me to come down to speak about these issues in Tunica, Mississippi. And I've traveled the country. I just got back.
We've both been to Mississippi.
From Myrtle Beach just this week, talking to leaders there in South Carolina. And I'm going to say this. Thank God we live in Massachusetts. If I ever felt that before, I feel it now. It's unfortunate that the country won't have the national guidance on data and science with the CDC on vaccines. What's the truth about the efficacy of vaccines. We know what the truth is in Massachusetts. And I stood with the governor on Friday and Commissioner Robbie Goldstein with DPH, Department of Public Health. And we stood at Greater Lawrence Family Health Center to state our collective commitment to science, to data, to access to vaccines. So again, we have a phenomenal congressional delegation with your leadership, Congresswoman. We got a fabulous governor, a great DPH commissioner who's committed to this, a fabulous director of Medicaid, Mike Levine. We are lucky to be in Massachusetts. To the caller, you're going to have access to vaccines here. I just worry about the rest of the country. And as those of us who do national work, we'll need to continue to fight for the rest of the country as well.
Thank you. Thank you both, John and Michael. Kelsey, I think that concludes our questions for the call. I just want to thank all of you for participating in this, for your questions tonight. Questions will be collected that we didn't get to, so that we can make sure you have the resources and information you need at this time. And I just want to, again, thank our special guests for being with us, for the work you're doing every single day for the Commonwealth and the country, and making sure that we have a government that works for people and is putting patients first. I know we are all committed that healthcare is a right and should not be a privilege. And we thank you all for your time tonight and for the work that all of you are doing. Once again, thanks to all the callers, and please be in touch if our office can be of help. Thank you.
Please press 1 to leave voicemail. Please press